Hello, I'm Monica. I'm the second negative, and we're talking about the Affordable Care Act, and the healthcare law builds on what works in our healthcare system, and it fixes what's broken by providing you with more health insurance choices and better access to care. Dr. Micah Weinberg states that the Affordable Care Act provides an important framework for expanding healthcare coverage in a way that can boost employment, increase overall economic activity, and make people healthier. So my opponents both mentioned that jobs would be lost, and that, but according to the Bay Area Council, their site is that it's on the Affordable Care Act, creates almost 100,000 jobs, boost economic activity in California by $4.4 billion. It also states that the biggest expected jobs gains occur in Southern California with almost 5,800 new jobs. Followed by Sacramento Valley with almost 13,500 new jobs, and the Bay Area with 7,600 new jobs. San Diego County with almost 6,500 jobs, and the remaining 10,000 jobs spread throughout other counties. So, by focusing on expanding health insurance coverage, making our healthcare system more efficient, and making our workforce healthier, we can realize important employment and economic gains from this Affordable Care Act. So these new jobs will allow an opportunity for these people to support themselves instead of relying on government subsidies like food stamps or like money to help support them. So they say that I think Rachel states that young people won't be covered, but if you sign up, it doesn't matter how old you are going to be covered. They are young children that are being signed up, and they are covered. That's why we have the Affordable Care Act. It's affordable for anybody. It's on how many people are covered now. According to the Business Insider, it states for the first time since this past Thursday, the White House released data on the question. According to the Department of Health and Human Services, about 87% of people who signed up through federal health care exchanges, they were also previously insured. So all those people who weren't and are, they are insured by other, weren't insured by the Affordable Care. Everybody's insured now, and they are being covered. According to Healthcare That Works for Americans on the whitehouse.gov, it states that thanks to the Affordable Care Act, more than 8 million Americans have signed up for the private health coverage, and that's not including the 17.6 million children with pre-existing conditions. They are signed up and they can no longer be denied coverage. And the 17.6 million, that's not even counting the adults who are now covered by the Affordable Care Act. I have a testimony on, out of like the thousands that there are, there's a testimony from the whitehouse.gov, and it's Tom, a 60-year-old self-employed man in Alexandria, North Carolina, states that he enrolled at healthcare.gov in 1 hour. His premiums are dropping by 225%. His deductible is dropping from $5,000 a month to $2,000, and his benefits are expanding. So with him signing up through the Affordable Care Act, his deductible dropped by $3,000. So it is affordable. My opponents failed to mention what the Affordable Act has done for these people and who are now signed up with it. There's an end to limits on care. According to the whitehouse.gov, in the past, some people with cancer or other chronic illnesses ran out of insurance coverage because their health care expenses reached a dollar limit imposed by their insurance company. Under the healthcare law, insurers can no longer impose lifetime dollar limits on essential health benefits and annual limits. And more than 105 million Americans no longer have lifetime limits thanks to the Affordable Care Act. They didn't mention the free prevention benefits that the Affordable Care Act has. It's on the whitehouse.gov. It says insurers are now required to cover a number of recommended preventative services, such as cancer, diabetes, and blood pressure screenings without additional cost, sharing such as copays or deductibles. Already 54 million Americans with private health coverage have gotten better preventative services coverage as a result of signing up with the Affordable Care Act.